In managing atrial fibrillation, it is important to control the heart rate. This is considered one of the primary aspects of care, alongside heart rhythm control, stroke prevention, and maintaining a healthy lifestyle. The main objective is to ensure that your heart functions consistently and smoothly in the long run. So, what exactly is heart rate control for atrial fibrillation? Well, it's not a cure for AFib, but it's a way to keep your heart rate in check. This is done using medications that help prevent your heart from beating too quickly. You would take most of these medications regularly, and use others when you're experiencing sudden problems. The goal of these treatments is to slow down the rate of your heartbeat. By doing this, it can help reduce AFib symptoms and improve your overall quality of life. It can also improve hemodynamics, which is how well your heart and blood vessels move blood through your body. The target heart rate for you may vary depending on the severity of your condition. If you're experiencing symptoms of AFib, your doctor will likely aim to get your resting heart rate below 80 beats per minute. However, if you don't have symptoms and your left ventricle is working well, the goal may be a bit higher. Without treatment for AFib, your heart rate could reach 150 beats per minute or even higher. When you have atrial fibrillation, your heart doesn't pump blood as effectively as it should. If your heart beats too quickly, it can make your symptoms worse and even lead to heart failure. This can also cause chronic disease of the heart muscle if your heart rate stays too fast for a long time. When it comes to managing atrial fibrillation, there are two main approaches: rate control and rhythm control. Rate control focuses on managing the speed of your heartbeat, while rhythm control focuses on the regularity of your heartbeat. While there is debate among scientists about which approach is better, rate control drugs are generally considered safer and can also help treat heart disease more broadly. In fact, some studies have shown that when rate control treatments are combined with anticoagulant drugs to prevent blood clots and stroke, they can be just as effective as rhythm control methods. There are different types of rate control drugs available for atrial fibrillation. They work by blocking electrical signals in the atria of your heart, which helps to keep these signals from reaching your heart's ventricle. Your doctor will decide which drug to prescribe based on the severity of your symptoms, how well your heart is pumping blood, whether you have heart failure, the cause of your AFib, any other conditions you might have, such as heart valve disease or left ventricular dysfunction. The three main types of rate control drugs are beta blockers, calcium channel blockers, cardiac glycosides. These drugs all have some potential side effects, such as fatigue, shortness of breath, and dizziness. It's important to be aware of these potential side effects. Your doctor will start with beta blockers most often, but if these drugs don't work or you can't take them, they might prescribe a different medication called amiodarone. To make sure you're on the right dose, your doctor might use tools like electrocardiography, ambulatory rhythm monitoring, or exercise testing. If you need quick rate control during an AFib episode, your doctor might use 4 medications or electrical cardioversion.